Hello everyone, dear friends, and welcome to our channel. Let me remind you, we specialize in this field. We treat the musculoskeletal system. Not only the spine, but also the limbs. Both upper and lower limbs are involved as well. They are also part of the musculoskeletal system, of course. Today we have a patient with us. Her name is Oksana. Oksana, can you tell us what's bothering you?
Hello, doctor. I'm generally troubled by back pain in the upper part, around the shoulder blades in that area, and also in the lower back. By evening, the pain becomes very severe.
So during the day, you can wake up without any stiffness, no pulling pain, nothing at all? Are you going in the morning?
Yes, I can wake up without any issues, but here it feels like there's constantly some tension in these muscles. And furthermore,
you have a desk job, right?
Yes, in an office.
And how does it feel for you when you are sitting there at the computer?
I work for 7 hours. Well, basically, I'm in this position all the time, constantly with the mouse. I work in tourism, booking tours and airline tickets. And for quite a long time, I just sit there without leaving, filling out documents and such. And basically, I only go out for lunch for an hour, and the rest of the time I'm sitting. You can't really stretch there. The office is small.
Are you ready?
Yes.
Well, we're ready too. Let's move on to the diagnostics. So, dear friends, we are ready to begin our laser diagnostics. We'll measure height, check for symmetry or asymmetry, and also do functional muscle tests with torso rotation and head turning. And what else? And yes, to watch the full video, you need to follow the link. So that's it. All right. Anything you want to say?
I really do not know what to say.
God willing?
Yes.
Well, I actually happen to know exactly how to set everything up. So, Kolya, you should just try to sit back and relax. Scared, huh? Or as you know? It happened with a bang. Relax here, this part. Good, let go. You can comment. You're doing everything right. Relax. More. More. What did you want to say?
It's cracking.
Come on, inhale, exhale.
Somewhere deep inside, right around the center of my chest, I felt something suddenly snap and crack. No pain at all, I would say. When it's lower, in the back, yes, there's a little bit.
Did you hear it?
Yes, I did just now too.
Where was it?
It was somewhere in the ribs.
Other side, turn your head. Listen carefully again. Now, where is my... Let go. Relax, relax. Now I'll tell you where it was. It was in the shoulder joint. But here the patient might also feel it because when I pull, I also press down in the chest area. That's why it works both in the thoracic and in the shoulder area. Right? Excellent. Alright, that is looking good. Now I would like you to slowly turn towards me and lay onto your side. Can you do that? Closer. All right, I understand. That is fine. Come on, just like that. All right, relax. Actually, there is no need to stretch here. What was that? Here.
This very specific one that we have right here.
Hurts.
It hurts? Yes, it does.
Now?
Right now, it really feels exactly like after a long workout. That specific kind of deep fatigue. Right over on this side of the room.
Turn towards me. As I'm pushing outward against the tissue here, that's exactly why you're feeling this discomfort. Plus, there is a lot of tension in the muscle. The pectoralis major also stretches in this case, so the patient can also turn. I feel discomfort. Is it less now? Here it's less.
Yes, for sure.
Good. Sit down with your back to me. Clasp your hands behind your head. Okay, just slowly round your head down. Bring it towards me. Now just try to smooth it all out. Clasp. Tight. Head down. Open your elbows. Just keep doing it exactly like this. You are doing it just like that now. That is exactly what we are looking for.
It actually cracked right over here.
One last time.
It really doesn't hurt all that much.
So are you sure your neck is really ready? Excellent. Let's move on to the cervical spine. Relax.
Subscribe.
I am honestly trying to remember if I ever actually went through the steps to sign up for a subscription to this particular service. Telt. Just try to relax.
Subscribe.
All right, I'm going to subscribe now. Tell me, how are you feeling?
I think it feels a little bit better, of course. Everything has been loosened up. And after the manipulations were done, I think the sensations got better. There's no tension. Definitely here.
Message received. Let's continue. Turn your head, hold it, hold it. What happened?
It was quite painful to get involved here.
Stop, stop. Keep holding, holding, holding. More. What happened?
It hurt.
Did you hear a click?
No, I didn't hear a click. Over there to the left, I heard a click, but as far as I could tell, not here.
That's surprising. It's just that I can hear and feel it. But what I'm saying is, the distance to the ear isn't the same. You see, it's not about the distance in centimeters, but rather about how close it is. And in any case, many people don't hear it. A lot of people, actually. But we do have videos where I actually use a microphone. Yes, those microphones. And yes, well, I hope it was audible there. Because some patients, like my finger just cracked. Everything cracks for me on the first patient. Or in the morning, when I do it myself, if I get the chance. On the stomach.
It definitely feels like there is quite a bit of pressure, but I don't hear any cracking sounds at all.
Chin to your chest, arms along your sides, move your hair away. One, two, three. Again.
Now there definitely was a crack.
And that's just the beginning again. Turn over onto your back. We're moving on to decompression. Do you know what that is?
Not really, no.
You haven't heard of it. You recommend everyone to subscribe, but at the same time, you don't know what compression is. Well, guys, let's show her. It is not just girls who are swimming here, of course. But recently, the channel's detailed statistics have shown that it is mostly girls participating. We're being watched just fine, so... Greetings to the fairer sex. The person of Oksana. They've already greeted her. So, are we moving on to compression now, Anton? How much longer? Come on. We're ready now, right?
Yes.
I'll subscribe, okay? Alright, let go. Relax, just don't try to control it, okay? Anton, relax even more.
Probably felt it somewhere around here.
Yeah, I heard it too.
It cracked.
Great, great. More? Alright, okay. Did you like it?
Yeah, the stretches are easier now. We did it.
We made it easier, good. Express test. Have you ever done an express test?
It depends on what it's for.
That is a great question.
I did one for COVID.
Relax your leg completely. Let your leg's full weight go. Pay attention to your leg, to your hip joint. Nothing. So when I stretch, it pulls all the way through the torso, right? Remembered? No need to save it? Remembered. Let's go back. All right. Did you hear that? Is it weak?
Yes, it cracked.
But that's not all. I'm showing this just for you. The setup. Well, what changed?
A little bit. There was something here when I moved.
All right, let's go ahead and try that one more time.
Oh, now it's here.
Let's try that once more, please. So now there's some movement here?
Yes, probably yes.
Good. Lower it down slowly, so bring it back up and then go up again. I hope there was a block here. We removed the block and now we've completely, terribly killed you. Relax, lower your leg. As if... you were blocked. Did you have surgery?
Yes, I did. Laparoscopy.
More, relax even more. I understand the discomfort. Remove now. Let go. Relax your leg completely. What appeared?
Well, now that's more free. Oh, there's a crunch here.
I couldn't resist. Come on your stomach, turn around and stand on your forearm. Young people together. Let's connect. Looking ahead. Relaxed. More. More. Finish, finish, finish. We're done. And now we move on to the control test. Dear viewers, I wish you to watch the full video. Cervical. Well, Oksana, yes, rejoice. We finished for today. Please give me a couple of kind words, so to speak.
I felt so much better afterwards and my tension really started to subside. It was in the muscles, specifically the upper back muscles, closer to the shoulder blades, because usually there is quite a lot of pain and discomfort in them. But now there is this deeply relaxed feeling, almost as if everything was thoroughly kneaded and massaged, so to speak. It's a sense of tranquility, and the muscles accordingly hurt less too. And there are pleasant sensations.
Excellent. Hold on to that.
Thank you.
You are officially pumped up for today. Well done. Well, let's let her go. Oksana, so to speak, while she's still holding on to it. Dear viewers, thank you so much for watching the video to the end. Subscribe, leave comments, and share the video. And do everything else as well. Sending hugs to everyone, lifting you up, putting you down, giving you a kiss, and letting you go. See you next time. Bye.
Thank you.
Bye.